My name is Gete Fantabi. Today I'll be presenting my in-service on calcium deficiency. Before I start my presentation, I would like to introduce my audience.
Hi, my name is Ken Varghese.
I am Thai.
Hi, my name is Farzana.
Hi, my name is Sarir.
Hi, my name is Laramie.
Alright, thank you for being my audience today. Calcium deficiency. On calcium deficiency, when I would like to start about presenting calcium deficiency, I have three objectives. The first objective is to review a background information on calcium deficiency. The second one is to discuss the cause of calcium deficiency. The last one will be to discuss different methods to prevent calcium deficiency. Alright, so what is calcium? As we all know, calcium is a mineral which is necessary for building healthy bone as well as enabling blood to clot and muscle to contract and heart to beat. So this is an indication that how calcium is important for our daily life and also how our body cells function with the help of calcium. So this is very important element. This is very important mineral. This is one of the electrolytes that we need for our body. So how calcium deficiency occur? So because our bodies do not produce enough calcium by their own, it's vital to get enough calcium from the food we eat. And also it's very important to know and measure, to know the amount of calcium that we are taking daily and knowing which group of food are rich in calcium as well. Right? So when I try to present about calcium deficiency, first of all, what is calcium deficiency? This is low in calcium. There's a medical term called hypocalcemia. It can be a pretty serious condition. Calcium is found throughout our body, but mostly in our bone. Calcium is also very important ingredient in development of strong bone, healthy bone. It's also very important in preventing bones from becoming unhealthy later in life, especially in elderly. So age group selected for these presentations are elderly patients or elderlies, adults 60 and older. The reason this age group was given because they are particularly vulnerable to calcium deficiency. As we age, the amount of calcium consumed in our diet decrease because the metabolism and the way that our body is processing the calcium in the other ingredient will decrease because of the difference in physiology and pathology of the body. Also, it's recommended for women in this age group to take calcium as well. So my main age groups are 60 and older, adults 60 and older. So how do we know that we have calcium deficiency? This is a good question. There are signs and symptoms that gives us a clue or an indication that somebody or we have calcium deficiency. The first one is muscle spasm or muscle problem. So whenever there's a calcium deficiency in our body, when there is low calcium in our body, there will be a cramp, muscle cramp, ache, spasm. They are the earliest sign of calcium deficiency. Sometimes we may probably feel numbness or pain. The other one is osteoporosis or osteopenia. This is like a thinning of bone. When the calcium level in our body get low, our body take calcium from the bone, making them brittle and easily injured. So both of these conditions reduce mineral density in our bone. So due to this reason, the osteoporosis or osteopenia it will occur easily, and this is one of the signs and symptoms. The other is severe PMS. Low calcium level have been linked to more or moderate to severe PMS symptom. The other one is extreme fatigue. Low level of calcium can cause insomnia or sleeplessness. The fatigue that comes with it also leads to lightheadedness, dizziness, as well as lack of focus. And as elderly patients, they are very known for forgetfulness or confusion, and that could be, that could be related to the calcium deficiency. The other one is depression. Calcium deficiency are believed to be linked to mood disorder like depression, and other bipolar disorder, mood disorder in general. The other is skin and nails. Calcium deficiency can cause skin to be dry and itchy, which research linked to eczema, especially and psoriasis. It can also be linked to the dry, broken, and brittle nails. So these are some of the signs and the symptoms that can easily be dental issue. Because the body draws calcium from the bone, when the levels get low, the teeth often become weak. We will have weak roots, irritated gum, brittle teeth, and also tooth decay. They can be an early indication for calcium deficiency in our body. All right, so what are the dangers of calcium deficiency? Calcium deficiency has been linked to multiple complications such as seizure, dental issue, skin condition, fracture, joint pain, and disabilities. On this, especially elderly patients, 60 and older, the main problem that they have is fracture. Their bone become easily fractured due to lack of calcium and other minerals deficiency. So the muscle will be weak and they will be disabled easily. So we have the best way to prevent or manage calcium deficiency. How do we manage if we know the symptom, if we know the sign? There are easy ways that we can prevent it. The first thing is to include foods which are rich in calcium. Knowing which foods are rich in calcium and taking them daily will be very important. Some of the foods which are very rich in calcium are beans, broccoli, tofu, soy milk, spinach, fortified cereals, dairy products such as milk, cheese, yogurt, nuts, seed, including almond and sesame seed. Regarding dairy product, there is some question that people can ask. Mostly older patients, as we age, it's not only as we age, but adult and older patients, they have an enzyme which digests milk. It will be running enzyme that is low compared to kids and children. So it's not taking too much milk that will help, but taking appropriate amount of milk product, whole milk product, dairy product will benefit also. All right, so ways to prevent, the other ways to prevent calcium deficiency outside of food. So outside of food, there are supplements that can be taken to decrease calcium deficiency. There are some calcium supplements, over-the-counter calcium supplements that an individual could take to prevent calcium deficiency. So 30 essential bone building minerals. What are they? So my main focus is on calcium deficiency, but the minerals like boron, calcium, zinc, copper, magnesium, potassium, phosphorus, manganese, nickel, selenium, strontium, all these have a great benefit to build our bone mineral. All right, so this will be the end of my presentation. I'll take any of the questions if you have any other question for me.
Yeah, I have a question for you. What medications would you separate calcium from? I know certain medications can cause chelation. Can you name a couple?
Of course, yeah. There are certain kind of group of medication that are not recommended to take with calcium supplement, especially antibiotic like tetracycline, doxycycline, or some of medication that helps to decrease GI secretion, acid secretion like pantoprazole or the pantoprazole medications, levothyroxine. So we have to separate them a couple hours before we take them. So to maximize the absorption of calcium or to maximize the effect of the calcium supplement that we are taking. So spacing a couple hours or taking them separately will be recommended.
All right, thank you.
Okay, my question is, do you recommend calcium in breastfeeding mothers?
That's a great question. So even if my study age group are limited to 60 and above, I'm so happy for you to ask that question. Yeah, women's childbearing age, any pregnant women or child breastfeeding women, it's very recommended to take calcium supplement because when they get pregnant, as the fetus build, so the baby will take calcium from her, from the mom. So if she don't take some calcium supplement, and then her bone will be weak, so because the fetus will be taking calcium from her body. And also when she breastfeed, the milk it have all the essential nutrients in them. Calcium is one of them. So if the mom doesn't take supplementation, calcium supplement, and then she will end up having a problem later on when she get age or somewhere. So taking calcium supplement for breastfeeding mom and pregnant women is very recommended as well.
So what are the benefits of taking calcium and vitamin D3 together?
Okay, thank you for asking that question. Calcium by itself, there is a limit. There are certain amount of calcium that will be absorbed into our body. Anything more than that, it will be just excreted. So to maximize the absorption of calcium into our body is recommended to take it with vitamin D3. So the main purpose is to increase the absorption.
Thank you.
I have a question about what are some methods used to prevent calcium deficiency?
Okay, to prevent calcium deficiency, it's good to take calcium supplement. Taking calcium supplement 1200 milligram every day is very recommended for any age group. It's not only for elderly or childbearing mom. It's for men too. So anyone who's adult is very recommended to take at least calcium supplement daily.
Thank you.
Hi. I was wondering, is there a certain age group that's more susceptible to getting calcium deficiencies?
Of course, yeah. I think I answered that question, but I'll repeat that. The age group which are very vulnerable to calcium deficiencies are elderly, because as we age, the way our body is processing the calcium or other medication or other minerals will decrease. So due to the pathophysiology change as we age, so elderlies, they're very vulnerable to calcium deficiency. So it's recommended for them to take. And also, I'm a mom, so I recommend, like any woman childbearing age, it's very important to take calcium so they can protect their body. It's not only their bone, they will be protecting their mental status, they will be protecting their muscle, they will be protecting their heart. So I recommend taking calcium every day. It's not only me, the research also I recommend.
All right, thank you.
Thank you.
All right, thank you guys. Thank you guys for taking your time to attend my presentation today. That would be all. Thank you.
I took my question.